And joining me now is infectious disease physician at the Boston University School of Medicine. It's Dr. Bhadelia. Dr. Bhadelia, welcome back to Meet the Press. I can't shake this fact, Dr. Bhadelia. The president gets diagnosed with the virus and within 24 hours is hospitalized. That is not the experience of most COVID patients.
Good morning, Chuck. Yeah, the president currently is one of 30,000 Americans who are hospitalized, which really is raising the point that none of us are immune to this, and it's not some silver bullets, just as only as testing or only medications, but really the whole measure of mitigation steps that are required. Everybody's course in COVID is different, and it's really hard for me to comment not knowing his own case because he is high risk for the reasons that others have talked about with his age, with the fact that he's a male, with his obesity. But it is a bit, generally the course that we see is that it is from 5 to 7 days after symptom onsets. It's when you generally have a median of when people develop respiratory symptoms, might see a drop in oxygen. His course may have been faster, or they may have moved him. It seems like there was an event on Friday. Clearly, there was some event on Friday that led to a decompensation with this fever, potentially that he needed the supplemental oxygen that drove them to take him to the hospital. So it may have been a combination of the fact that he's the president, the fact that moving him to the hospital gives them chances to give him more therapeutics, and potentially that he's either having a longer course or potentially he may have had symptoms longer and may not have realized that he's had symptoms because they were vague and, may just have been fatigue.
What should we be on the lookout for when we do get briefings from the president's physicians that while, they may present something that seems very anodyne, but actually will be very telling? What are some of the things you'll be looking for in some of these updates to tell you more about his condition?
Yeah, thanks so much, Chuck. The big things that we look for in COVID patients is, it's a 1-2 punch. When first the virus sort of does the damage that it's going to do, and then it revs up the immune system. And what happens in this setting is that you have a maladaptive immune system that then starts attacking your own body. And so what we're currently looking at is that he received 2 medications, one that's under compassionate use, and the antiviral remdesivir. There's meant to bring the viral load down. So they're looking to make sure that they've brought the virus down enough in his body that he doesn't have that harmful immune response. So the kind of things they will do is they'll follow him clinically. They're probably already doing imaging, if not have not done it already, to look to make sure that the lung disease that he may have from this hasn't progressed. They'll look to see if his body is responding with high inflammatory markers. And so the things that I'd be looking for is that if he receives dexamethasone, the steroids that we've been talking about, that's a sign that they're worried that his immune system is now revving up. So that'll be looking at that, the inflammatory markers, and of course how he's doing clinically.
I hope you heard in our previous interview how often Jason Miller said, well, we're tested all the time. They test all the time. Should this puncture the myth finally that testing isn't, just saying you've conducted tests doesn't replace the mask?
Yeah, Chuck, testing is a pillar of the part of the way that we respond to this, as you and I have previously talked about. But in itself, no one thing is a silver bullet. And what the testing in this scenario did is it did help them pick up people earlier. However, it didn't. All it does is it's a diagnostic. You need to follow it up by having all those additional measures that if someone does turn out to be positive, the others who may have been exposed to that person don't get sick. When you put that mask on, when you keep that distance, it reduces the chance that if you have a test that came back negative because someone was early in their disease or because it was a false negative, that you don't have this type of scenario where people get exposed and it becomes a bigger cluster. So one thing I'll say is that the thing that may have hurt in this situation is that dose of virus that you get exposed to may decide your severity, and not wearing a mask exposes you to a larger dose of the virus.
Dr. Bhadelia from Boston University, really always appreciate having your perspective and expertise on the show, so thank you. Hello from Washington, I'm Chuck Todd, and thanks for checking out the Meet the Press channel on YouTube. Click on the button down here to subscribe and click over here to watch the latest interviews, highlights, and other digital exclusives.